Hi everyone, I'm Carrie Chevarelli. I'm an Austin-based physical therapist and the owner of Healing Foundations Physical Therapy. I'm also a breast cancer survivor, having gone through treatment with chemoradiation and deep flap reconstruction. Happy to be providing some video footage to hopefully help you in your journey of recovery following surgery. I will say, please consult with your physician prior to doing anything that you see in these videos to make sure that it's safe for you and that you've been cleared medically before performing any stretching or modalities of choice. Thank you. So we're going to demonstrate a stretching technique again for the pectoralis muscle that uses a tool, and it's in the therapy world known as active assistive. This is a massage stick, but you can feel free to use anything that's a lightweight, like a golf club, a broom handle, anything that you have handy. The non-affected side, the left side, is going to be assisting with the motion through the right side. The pectoral muscle is from the top of the breast towards the shoulder. That's the area that we want to feel the stretch. Make sure when you do this technique that you start out in a comfortable position. You don't want to already be on a stretch just with the position of your arm. So for some patients, it won't be comfortable to have their arm this far off of the bed or the table. You can also have the arm completely on the table if necessary. So you're going to slightly rotate your stick, and you're going to use the left hand to bring it on a diagonal kind of back like so. You'll notice the pectoralis muscle right there engages. You count 20 or 30 seconds. When you feel the stretch, breathing while you're stretching in and out, deep breaths, and then release your stretch. If you're not someone who likes to count, you can use an inhale and then a long exhale as you stretch, which is also a nice technique. This stretching technique that we're about to show you is to help open the side of the chest and across the front of the chest and top of the shoulder. So laying on your side with your arms extended out, you can do this on a floor or, as Tasha's doing, hanging off of a bed. She's going to bring her top arm across to help kind of open the top of the chest, start to induce rotation through the rib cage. You want to be careful to avoid twisting excessively in the low back. You can also put pillows behind you, a stack of pillows, if your arm and your range of motion does not allow you to go back all of the way. Stay in a comfortable range, but feel an opening across the chest and a lateral chest wall. You want to repeat this on both sides of your chest using the opposite arm as well, so that you feel symmetric and that both sides are moving equally. This exercise can be progressed once you are released for strengthening by placing a weight in the hand and doing the same exercise. One of the areas of the body that's very affected by breast surgery are the shoulders for many individuals. And shoulder flexion, or the ability to raise your arms overhead, is very tight. A neat technique that you can use to help stretch that area is with a tool such as the massage stick. And you're going to use the non-affected side or the side that is less affected to help move the more affected side. And this way you also maintain more symmetry during your stretch. So Tasha's going to just simply raise the stick over her head, like so, until she feels a stretch, pausing briefly, moving back and forth through that range. Make sure that you're in a comfortable range while you do this. You don't have to go back quite as far if you experience pain or discomfort. A simple set of 10 of these exercises is more than appropriate to start out. Another area of the shoulder that is oftentimes tight following breast surgery has to do with the pectoralis and the shoulder external rotation muscles. This is a stretch, again, using the less affected side or non-affected side to help bring the hand back and the arm back into external rotation. For a lot of us, that is the ability for us to reach up and be able to touch our head, be able to reach behind us for something. Those are the types of motions where this comes into play. As mentioned with some of the other stretches, the amount of arm that's hanging off is up to you and your comfort level. If it's not comfortable at all to have the arm hanging off, or it needs to be propped with a pillow, please do so. All of the stretches are just to a stretching point, not to pain or spasm. A set of 10 repetitions of this on the affected side, or in the case of both sides, is more than adequate to start. Another technique for helping to open across the top of the chest and for shoulder and arm motion backwards is using the stick and simply lifting it a few inches off of the surface. I like to do this exercise on the side of a bed or in a piece of furniture that doesn't have a back to it, so that you have the freedom of the arm motion. Make sure when you do this exercise that you keep your shoulder blades engaging, meaning you don't want to hunch your shoulders up because you can cause yourself to have some neck pain. Only to stretch, only to comfortable range. It'll feel intense in the front of the chest, across the front of the shoulder, as well as all of the muscles around the shoulder blade being activated. 10 repetitions is more than adequate to start. And if you find that this position you cannot put your hands in, you can also turn your hands over the other direction if that's more comfortable. Again, making sure you keep the shoulders nice and down, lifting only to a stretching point. One of the tissue groups that is often affected when someone has breast surgery are their nerves. There are 3 nerves going down the arm: the median nerve, the radial nerve, and the ulnar nerve. It's important to make sure that you have freedom of movement within the nerves, as that can impact your overall arm motion. The technique that Tasha is going to show is to stretch the median nerve, which comes down the forearm. So she is simply just leaning back and putting weight through her wrists to comfort, and then leaning back to an upright position. It also is a nice stretch in this position across the front of the chest as well. You want to make sure that you don't have any numbness or pain in your hands while you're doing this stretch. And of course that you have the available range in your wrist to be able to do it. It can be modified by putting a towel or a prop under the wrist if that's not comfortable. 5 reps to 10 reps max during a day is plenty for a nerve stretch. This is another technique to help stretch or floss the median nerve coming down through the arm, especially if you're limited in overhead arm motion. So you pull back on your fingers like so to stretch across the wrist, and then simply engage your shoulder blade and lift your arm, and you'll feel a stretch coming down through the arm from the shoulder going towards the wrist. This can also be done laying on your back if it's more comfortable. This is a technique to stretch the underside of the upper arm. Tasha's going to be raising her elbow up towards her ear And she'll feel that in both the ulnar nerve as well as the triceps and muscles down through the chest wall. When she gets to her stretching point, she can hold and count to 10. Also, taking a nice deep breath and exhaling through your stretch is a wonderful technique with this. I would always advise with this stretch to do both sides, even if one side is a lot tighter than the other, just so that you feel symmetric. 5 repetitions to start, moving towards 10 repetitions when it becomes easier. This technique can also easily be performed laying on your back if it's more comfortable for you. One area that's often affected after breast surgery is the upper trap muscle, where we tend to hold a lot of tension, and it's a muscle that guards for protection of the chest and the shoulder. The upper trap is located right along the side of the neck from the base of the head coming down towards the shoulder blade. Many of us will get knots in this area and it will go into a spasm and be very uncomfortable. We're going to show a technique for stretching that in a seated position. So you'll notice Tasha's going to be stretching her right upper trapezius muscle by holding on to the base of the chair with her right hand and leaning her head towards the left side. When she feels the stretch, she's going to count to 10 and exhale before moving towards a more neutral position. You want to make sure you keep the right shoulder down while you're doing this technique, and yet you have support behind your back, such as in a chair. Before performing this technique, make sure that your doctor has cleared you to bring your arms and your hands over your head. That is very important because you will be there for longer than a few seconds. And also, try to remember to make sure you perform the stretch on the right side and the left side, regardless of what side your surgery was performed on. You want to be symmetric, especially when it comes to neck motion. I hope you found these stretches to be helpful for you as you recover from your surgery. Please remember to consult with your doctor and heed any post-op instructions that they may have given you prior to performing any of these techniques that we've shown you. Make sure that you keep yourself comfortable and safe. Make sure that you heed any sort of warnings or safety measures that you need to. Thank you for watching this, and I wish you the best of health.